Seconds.
Good evening, everyone. I'm Lisa Bartlett, Orange County Supervisor for the 5th District. We appreciate all of you joining us this evening. Joining us this evening also we have Dr. Clayton Chau, our County Health Officer and Director of Healthcare Services. And as the title indicates for tonight's presentation, it's a matter of how we move forward in a post-pandemic environment and how we make progress over the past year and where we go from here. Dr. Chau will update us on changes relating to the vaccination distribution program and eligibility and the blueprint metrics. This past year has been extremely challenging for all of us. Due to COVID-19, many businesses were forced to either close or lay off or furlough employees. Thousands of people were suddenly without a job and were struggling to put food on the table. But what a difference a year makes. We're on the cusp of winning our battle against COVID-19. Businesses are starting to open up again, and employers are hiring once again. Orange County's economic engine is on the brink of coming back and being on track. Our goal is to continue to push forward so we can fully reopen in a safe and effective manner. And as the next slide indicates, Operation Independence. With that, our best bet is to move forward through the tiers as quickly as possible, get people vaccinated as quickly as possible. And at the start of this year, the county announced a bold plan to vaccinate all Orange County residents who want a vaccine by July 4th. We are referring to this goal as Operation Independence. Operation Independence will allow us to open our economy further, spend more time with loved ones, and celebrate our united strength and endurance during this very difficult time. And moving on to the red tier slide, we are already making progress on moving through the tiers due to success of our lowering case rates and vaccine distribution efforts. As I'm sure many of you are aware, Orange County officially transitioned to the red tier this past Sunday. This was much welcome news for many Orange County businesses, particularly our small business community. Now that we are in the red tier, restaurants and movie theaters can open at 25% indoors, gyms can open at 10% indoors, and even amusement parks can open after April 1st. We will continue to increase our vaccination efforts as supplies allow us to continue to move through the tiers and reopen more of our economy. Dr. Chau, can you explain the many changes that have occurred regarding the vaccine distribution channels and current eligibility?
Thank you, Supervisor Bartlett. Good evening, everyone. Clayton Chau, Healthcare Agency Director and Orange County Health Officer. I think what Supervisor Bartlett said earlier is really important, is the changes in our blueprint and how we got to the red tier so quickly based on the vaccine. So there's a tie-in to it. So Supervisor Bartlett, before I go in, if you're okay, I'm going to explain the changes in the blueprint threshold that get us to the red tier this last Sunday, and so people understand it. And so the governor 2 weeks ago made an announcement that we will be able to change the threshold from the different color, movement from different color. For those of you who don't remember, the blueprint for returning to our economy has a different color. Purple tier as the most restricted tier, then you move to the red, orange, and then yellow. And so what happened was 2 weeks ago, Governor Newsom announced that if we're able to vaccinate a certain percentage of folks who live in the lowest socioeconomic status area in the state, which include 400 zip codes, and out of those 400 zip codes, Orange County has 4. And so all over the state, those 400 zip codes equal to 8 million people. And in Orange County, that translated to 170,000 folks in those specific 4 zip codes in Orange County. And so if we are able to vaccinate 2 million, which means a quarter of those people in California, then the governor and the Department of Public Health would move us quickly from the purple to the red tier, because the threshold between the purple and the red tier get a little bit more relaxed, right? And so That's how Orange County was able to move into the red tier immediately when the state reached that goal on Friday, and then we moved into the red tier on Sunday. So the next goal would be to ensure that half of the people in those 400 zip codes, which is equivalent to 4 million people, if they get vaccine in arm, and we achieve that together as the entire state, then we're going to be able to move easily into the orange tier, because the threshold between the red tier and the orange tier will get relaxed, right? So the threshold is the case rate per 100K. Now, we are projecting that the county, the entire state might be able to achieve that in a week or two. So the possibility of us being able to move into the orange tier is really, really good. So those are good news. And the reason I want to explain that is because how we can reopen tie into the vaccine in arm, right? And so that is one way to encourage folks that even if a vaccine is eligible for you and you are part of the eligibility group, we would encourage you to accept the vaccine. So, and how do we get the vaccine? As Supervisor Bartlett alluded to, currently there are several ways that vaccine can come to our local county. So the first way is through the federal government. So the federal government would allot the vaccine directly through individual county through a relationship with pharmacy. So there are pharmacy in California, including Orange County, that are receiving vaccine directly from the federal government. Those pharmacies are CVS, Walgreens, Rite Aid, and Albertson Pharmacy. Now, you cannot walk into those pharmacies, you cannot call the store, but what you would need to do is really go online to those 4 pharmacy websites and register. If they have appointment available, you can register. There are a lot of pharmacies that belong to these 4 chains exist in Orange County that will be offering the vaccine. And again, you have to be eligible based on the California and on the local county eligibility list. So that's one way vaccine comes to Orange County. The second way is the federal government also allocate a smaller portions of vaccine to several community clinics in Orange County to help support our effort in vaccinating. And those 2 community clinics are Vista Family Community Clinic as well as Ultimate Community Clinic. And altogether, these 2 brands of community clinics, we have about 10 sites in Orange County. Then the federal government would allocate the remaining portions of California vaccine to California. And then we currently have been receiving the vaccine allocation from the state. And very soon, if you look at the slide, there is on the right-hand column, it talks about Blue Shield or a TPA. That is still in the work. There is a transition and for that entity to do the allocation for the entire state. So they will be allocating to the county, a local health department, my department, our department, and then also private providers such as hospitals, such as any urgent care, primary care physicians' offices, as well as some pharmacy, because these are the providers that have been certified by the state. And so we don't know who will sign a contract to receive the vaccine, but that's how it would come. So the county is also part of that access to, and so we will be allocating and we will make vaccine available for our community. So on the next slide, it tells you who is currently eligible for the vaccine. And if you follow up until last week, people who are in the healthcare industry, people who are emergency responders, people who are 65 and older, people who work in the grocery store and food industry, an educator were available up until this past Monday this week, 2 days ago, where folks who have a chronic health condition now become eligible. as well as folks who live in a certain congregating setting. And we're going to get into more detail on that, okay? Next slide, we'll talk to you specifically about those chronic health conditions. And I know the slide is a bit small on the screen for you, but basically, if you have cancer currently in treatment, chronic health conditions, a kidney condition, a chronic lung condition that you require oxygen, if you have Down syndrome, sickle cell disease, if you have a weakened immune system, such as you're on medication because you had a solid organ transplant, if you're pregnant, if you have heart condition like heart failure, etc., if you are severely obese, or you have type 2 diabetes. Type 2 diabetes are people who need insulin or medication to control their blood sugar, particularly with what they call a hemoglobin A1C level greater than 7.5%. So those are the health conditions that would qualify you this week to receive the vaccine, okay? Next slide, we'll talk about, well, how do I know when I'm eligible? And you live in Orange County, you probably have heard we talk about Othina, and I know Supervisor Bartlett was the very first supervisor to really support Othina, to get people enrolled into Othina. It is an app and an online solution where you enroll, and then it will inform you when there are appointments available for you to receive the vaccine. I want to let you know that we have a lot of people eligible, but currently, up until this week, the allocation come to the state and to the county remain to be very small. And so on the average, every week, we have about 40 to 45,000 doses that come to Orange County for everybody, with the exception of the pharmacy and the larger hospital like Kaiser, UCI, and Providence. But even they also get a very small portion. So the number of people who are eligible up in the million, but the doses are really, really small. So what I'm asking is for you to be patient. I'm very hopeful that very soon we will have more vaccine coming to California and to Orange County. As you have heard, President Biden a few days ago also announced that he want us, he promised that there will be enough vaccine for all U.S. citizen adults who want the vaccine by the end of May. And he's also looking forward to vaccinating to reach herd immunity so we can open and celebrate on July 4th. So that, for me, gives us a sense of assurance that our goal, Supervisor Bartlett talked about Operation Independent, and our goal to be able to open up fully in July 4th is a reality. So the hope for that is really huge. And so on this slide, for those of you who have not enrolled yet in Othina, and now you know you're eligible, please go on to othina.com to enroll. You can find more information about other places that you can get the vaccine, or which phase you belong to on covidvaccinefacts.com. Again, the website right now would encourage you to take out your cell phone and take a picture of this screen, right? So number one, it'll give you a website on where to go, so you know which phase you belong to or whether or not you're eligible. And then number two, it'll guide you to enroll on Othina. Now, next slide will tell you that when you enroll in Othina, when you are eligible, and then when we have vaccine and we open up the appointment, you will get an invitation to go in and to your appointment to get the vaccine. Okay, many people. Next slide, please. Many people have gotten the vaccine, and the experience through Othina. Currently, Supervisor, I think the latest number is that we have enrolled now over 900,000 people on Othina.
Right.
And we have vaccinated over 500,000 people in Othina.
Right, and everyone's had a really great experience at one of our pods.
Yeah.
But in order to continue that great experience, we want to have things stay efficient, and we need everyone's continued cooperation.
Yep.
So please arrive no more than 15 to 20 minutes before your scheduled appointment. The entire process is very efficient and takes about 45 to no more than 60 minutes. And please make sure you bring all of the necessary documentation, which includes photo ID and proof of residence or employment right here in Orange County.
Yeah, and thank you, Supervisor. For those of you who don't know, she also volunteered at our pod, and so it's great to see you out there. So you've probably heard that we have two super sites, right? So we have one at Disneyland / Anaheim Convention Center, and then we also have one down in SoCal University in Supervisor Bartlett District. And then next slide, we'll talk about COVID and its impact on mental health. If you fast forward, there we go. Next slide, please. And so we do know that this last 12 months, many of our children have been staying home and receive education online. Only a number of schools that were able to open before this recent lockdown for in-person education. But because of the state guidance, not all children were able to come back to in-person. And so because we're now in the red tier, there are opportunity for all schools to reopen for in-person education. What does the data say about the impact of COVID-19, particularly on the children and family? Supervisor Bartlett sponsored an event yesterday, and it was really good.
Yes, yesterday I was able to host a virtual event to discuss our annual Conditions of Children's report. And it gives us kind of a snapshot of the overall impact and status of children relative to economic stability, education readiness, and also health factors. But one of the most concerning conditions or outcomes that came about in the report was the increase in hospitalizations of children experiencing mental health illnesses. So that's something that we really have to kind of red flag. And I know that our panel of experts in the behavioral health area really discussed in detail about the risk factors and what we can do, what's contributing to the risk factors, but how we can mitigate those, how we can help the children through those very difficult times with mental illness. And unfortunately, right now, we're experiencing an increase in mental illness in children of all ages, and the emotional impacts are very significant relative to dealing with COVID-19.
Right.
So one of my top priorities has always been to increase access to mental health, particularly for our children. And we've made great strides at the county by partnerships that we've developed and looking at things like our BWellOC campus. And then for children in particular, there's the Children's Hospital in Orange for pediatric mental health. The CARES Act funding also gave the county an opportunity to expand on some of these great programs and initiatives that we already have in place. And I appreciate all of your efforts relative to really supporting the efforts of our county for mental health for all ages, whether it be children or young adults, and certainly adults as well. We've had challenges throughout time relative to mental health, and when we got into the area of COVID, we were already moving into a recession, which was difficult enough for a lot of people, and then the COVID crisis hit, and it was kind of a double whammy for a lot of our residents. And adults were losing jobs, children were getting stressed, they couldn't go to school, so the mental health issues really started to skyrocket.
Right.
And we really need to do everything we can, take best practices approach on how we can solve those problems for all of our residents in the county. And it's a matter of working together, and I appreciate all of the great resources that you've assembled, and looking forward to really making some great progress in this area.
Thank you, Supervisor. At this time, I think we should post the slide that have all the behavioral health resources. If you don't mind, post that on there for the audience. The audience, I would encourage you to pull out your cell phone once again. That's the slide. Take a picture of this screen right now, because it gives you information on how to access care, all the program that Supervisor Bartlett just mentioned earlier. So I want to get your attention to, on the right column, down the middle, the third bullet point, the OC links, and that is the county phone for you to call when you have crisis. Again, the number is 855-OC-LINKS or 855-625-4657. And again, you can go on to the county website to look for those information. But I would encourage you to really take a picture of this screenshot and save it. There are information about the 2 specific apps that the county have supported to develop. The first one is UN, it's 2 words. That's the app, the title of the app, and then that's how you can get to UN app, and then Biplucky app as well. There is an OC, Orange County Student Mental Health Community Networking Project. You can go on there and then get more information on student mental health. That's very, very helpful. And of course, on the suicide prevention, Be a Friend for Life, that is a campaign that we have started here at the county. Thanks to Supervisor Bartlett, I know a couple of years back, before the pandemic, you have supported the suicide effort here in Orange County. I think the seminar, the meeting yesterday that you hosted was taped, right, Supervisor Bartlett?
Yes.
I think so. So I mean, if you guys go on to a Supervisor Bartlett website, you have your own website, I think it's posted there.
Yes, they can connect to the link and they can actually watch the entire presentation.
Perfect. Supervisor, if I may, I'm going to next talk about a few facts about COVID-19.
Okay.
And so let's talk about the vaccine first. So if we post the slide, there we go. So currently we have 3 separate different vaccines available for people. The Pfizer and the Moderna, and just about a week and a half ago we got the Janssen, also frequently referred to as the Johnson & Johnson, forgive me, Janssen, or the Johnson & Johnson vaccine. All 3 are really safe, and all 3 have gone through rigorous testing in clinical trial with over 116,000 people. And the reason why the drug company was able to get so many people to complete the clinical trial so quickly was because everybody wanted to participate to find a solution. This is a global problem. This is a global pandemic. And we had no way out of this pandemic if we don't have a vaccine to protect people. And that's why normally this process of completing the required clinical trial take a few years. But because so many people globally wanting to participate to find a solution, and that's why we were quickly able to complete the clinical trial and for the authorization that we know, okay? So all vaccines are safe, and they don't change your DNA, okay? And the U.S. Food and Drug Administration gave the authorization for emergency use, and therefore, because this is not approved yet, it has a condition for emergency use. It does not require individual to get a vaccine. But I want to let you, those are the facts, but we want to encourage people that if a vaccine is available and if you're eligible and if you're offered a vaccine, please take it because currently the way out of this pandemic is getting our community achieve herd immunity, which means at least 70% of our community have to accept the vaccine, right? And so we have no way out of this pandemic without the vaccine.
And right now we're about at the 30% mark.
Yes,
correct?
yes. So if you look into the state website, the state said in Orange County, we have given out over 1 million doses of vaccine now. So we rank 3rd at the county in the state to do this. So I'm really thrilled. And there are more people who want the vaccine, and we want to ensure that people get the fact. Don't let me convince you, okay? Get the fact. Go onto our website, ochealthinfo.com. We have all the facts about the vaccine for you. Discuss with your neighbor, friend who have gotten the vaccine already because they were eligible, and talk to them about their experience, okay? But get the fact so you can make a decision to get the vaccine. I think I'm going to stop at this point, and then we can, I know there was some question that came in before Supervisor Bartlett, so we can have a conversation with each other. Is that okay?
Absolutely.
Perfect.
So some of the questions that came in, so I'll go to the first question that came in.
Yes, ma'am.
Someone had stated, now that I have the vaccine, does that mean I can start having gatherings and stop wearing a mask?
So let me address the very last point first. Sorry, I just need to make sure that I'm not missing any requests. So because we have not achieved herd immunity, because the majority of our community have not gotten the vaccine yet, so even if you finish the vaccine, the 2 doses or the 1 dose Janssen, you must continue to wear a mask when you're out in public, because you now need to protect other people. So as much as we know, we suspect that people who fully vaccinated could get infected, but they're covered, right? So they don't feel anything, they're asymptomatic, so they could spread it to someone who have not gotten the vaccine, and importantly, people who are vulnerable. So please continue to wear your mask when you're out in the public, continue to wash your hand, continue to stay distant from people who don't live with you or stranger, right? And so the gathering, the state, some of you, the person who sent the question probably knew that the CDC, the Center for Disease Control and Prevention, has just recently issued some guidance around people who have been vaccinated already. And so the state of California Department of Public Health and the health officer, my colleagues, are in a conversation with each other on how to translate that guidance to California for Californians. So we do know that if you are hanging out with people who are vaccinated already, right, then you're safe to take off your mask, right? And so let's say if you and your friend, a colleague, have been vaccinated already, you can gather together indoor at someone's house, but make sure that you have everybody vaccinated in that gathering, right? And so try to avoid gathering in a place where there are someone else who still have not gotten the vaccine yet, number one. Number two, particularly the vulnerable, right? So we do know that we have achieved vaccination for a majority of senior in our community, 65 and older, but at least a 20% to 25% still have not gotten the vaccine yet because we have limitation of the number of vaccine. So they are still vulnerable. So please, when you hang out or you are close to them, or if you go into a home where someone else already vaccinated, but you still have individual like the senior, for one reason or the other, have not gotten the vaccine, please make sure that you don't expose them to the possibility for transmission. So in those cases, I would say, wear your mask, right? Or make sure that the vulnerable person is not there in the same gathering with you.
Right, and when you talk about gatherings, you're talking about being fully vaccinated before you have gatherings.
That's correct.
That really means with Moderna and Pfizer, which are shots 1 and 2,
yes,
you have the second shot before
14
gatherings.
days after your second shot.
Okay.
Yeah. So there was a questions about, well, when do I fully protect it? So for Moderna and Pfizer, it is 14 days after your second shot. And then for the Janssen or Johnson & Johnson vaccine, it's 14 days after that single shot.
Okay, so the next question that came in, I have already registered on Athena. How do I update my profile to reflect my underlying health condition?
Thank you, Supervisor. We were discussing that on the way over here. So I think that you should be able to go into Athena and change your health condition, but let me double check on that, okay? It should be. If it's not, then we need to we need to fix that so you are able to go onto Athena and change your category so you would be eligible for us to give you an appointment when we have the vaccine. So that's a great question.
Okay, and then when someone arrives for their vaccination appointment, if they have an underlying health condition, what information do they need to provide to prove that they have an underlying health condition?
So in California, as you probably have heard, and actually Orange County, I want to say that Orange County is one of the first county that's proposed this, that we're going to go by the honor system. So when you enroll in Athena, and it asks you whether or not you qualify based on whatever it is, medical condition or what have you, it is honor system that you're going to self-test, a test that you qualify, right? And we're not going to check you. We might spot check, but I don't think we will. We're going to ask you to use the honor system and self-attest that you actually qualify. When you show up for your appointment, when you're giving an appointment, the only thing we're going to ask for is a an ID of any type with your picture just to confirm that you are who you are. So Clayton Chau show up, and I have to show something, passport, school ID, or what have you, that say, with my picture on it and said, yes, I am Clayton Chau. That's it. We just want to make sure that we give the vaccine to the right person. And so we can go into Athena and say, yes, Clayton Chau got the vaccine already. Yeah. And I know there was question, well, do I have to be a citizen? Because I think in one of the remarks that President Biden said, oh, for all citizens of the U.S., I think what he meant is for everybody who live in the U.S. And so just want to make sure that you understand that anybody who live in the U.S. qualify for it. And I'm going to go further and say in Orange County, we honor the fact that you live here and you work here. If you work here full time and you live in other county, but here is where it's convenient for you to get the vaccine, and we have the vaccine, we will invite you to get the vaccine, because we greatly appreciate for the service, whatever services is that you do here in Orange County to serve the people in Orange County.
Right. And so right now on the Athena application, scheduled appointments are limited because they're based on the availability of vaccines.
That's right.
So a question came in, when will we be getting greater amounts of vaccines than we've been getting, say, last week?
Thank you. So currently people enroll on Athena, and then they are put on a queue, right, a waiting queue. And so as we have more vaccine come in, we will open up the appointment for people to be able to get an appointment. We'll send you an invitation. What we'll do is we'll send you an invitation and we'll say, hey, Clayton Chau, you eligible, we have vaccine, we now open up an appointment, and please make an appointment, and here's the appointment slot, and here's the vaccine that will be given out for that appointment. And so you can kind of have a choice, because I know there are some talk out there about, well, which one is better. The consensus is they're all good. If you are eligible, if you have a chance to get a vaccine, please get it, right? But in case you have some preference for one reason or the other, you will know that you will get invited to a clinic, make an appointment to a clinic, and that clinic is offer vaccine A, B, or C. And then you can make a decision on whether or not you want to take that appointment. If you don't want to take that appointment for one reason or the other, because of the vaccine, or because that appointment doesn't fit with your schedule, you will be put back in the queue, okay? But you will get invited the next time when we have an appointment available. So there was some question, what if I can't make it, or what if I say no? And do I go back in the line, wait? No, we're going to put you back in the queue. So if you are the next eligible person, we will send you an appointment. But again, I want to encourage people, please make every attempt to make to your appointment. We're going to try and make sure that we have more appointment that's convenient for the community, but don't refuse the vaccine if there's an appointment offered to you.
Right. So at this point in time, we've already gone through some of the phasing of eligibility classes for getting vaccinated, clinical healthcare workers, public safety, et cetera. And we're moving through the phasing cycle right now. For someone who may not be 65 plus, do you recommend that everybody gets registered at least, so that when their time for eligibility arrives, they'll automatically get that notification to schedule an appointment?
Yes, great question. Thank you, Supervisor. Yes, I would encourage all of you to do that. And then I just remember that I didn't even answer part 2 of your previous question. Let me answer this one first. Yes, I would encourage you, you go on to Athena and enroll in Athena, and then as your eligibility as your eligibility is pushed up to the line and we have vaccine, we will invite you to make an appointment, okay? So Athena now is in Spanish, English, of course, Spanish, Vietnamese, Korean, and very soon we will have traditional and simplified Chinese. And I know in previous conversation with the community, there are requests for other languages, and we're going to look into that. So back to the previous question that Supervisor Bartlett posed, and I forgot to answer. Apologize, Supervisor Bartlett. And that is, when do we predict more vaccine will come? And so we do know that perhaps starting in April that there will be more vaccine available, because remember when J&J or Janssen vaccine was first authorized, the U.S. supposed to get 40 million doses by the end of March. There was some technicality. We didn't get the majority of those shipment yet, so I'm hoping that by the end of March, which is pretty soon, in a week and a half or so, we will have more J&J made available to us. And then I know in April there will be more Moderna and more Pfizer will be available to the U.S. And so we're looking for larger shipment to come, because President Biden just advised us advised states a couple of days ago to make the eligibility to all all adults in the U.S. by May 1st. So I assume that that's because we are expecting a large number of vaccines coming.
Right. And not everyone is technologically savvy and can navigate the Athena website. So some people have been having some difficulties getting registered. If they have questions, we have a hotline, correct?
Yes,
that they
ma'am.
Can call.
Yes. So there is a hotline. Write it down, 714-834-2000. Very simple. 714-834-2000. Or you can go on to the website if you took the picture already for the resources, that OC Info Facts, OCHealthInfo.com or OCCOVIDFacts.com. You will have information on how to call in, and then we will have people who speak Vietnamese, Spanish, and English to support you to enroll. But I do know quite a significant number of cities also have committed to helping people enroll in Athena as well. So call your local city. If they don't have staff that could help you enroll in Athena, they will be able to refer you back to the number that I just mentioned earlier, 714-834-2000.
Right. And then someone had a question about if they've got the mom and dad and 3 kids, if one parent gets registered, can they bring the rest of their family?
Well, at this time, no, because we only vaccinate those people who are eligible, right? Mm-hmm. So again, just to remind folks, eligibility, a healthcare worker, emergency responder, people who are 65 and older, people with health condition, people who have disability, etc. And so if you bring, we want to make sure that there's no walk-in. Currently, we don't offer walk-in yet. So you have to come to our site with an appointment. And so I hate to see you just come to the site and then get turned away, because that would be disappointing. And so when we open it up, the eligibility list to everyone, and there was a question that President Biden recommending state to open for all adults by May 1st. Well, that happened in Orange County. Well, that decision is based on the state. So county has to follow the state decision. So hopefully the state would make that decision. By May 1st, everybody's eligible. Then when you enroll in Athena, you'll be able to enroll your entire family on Athena. And then when we ask you to make an appointment, it will be an appointment for the entire family to come.
Okay. So we have the original COVID-19, but after the original strain of COVID-19, we now have a number of variants. The UK variant, the South African variant, the West Coast variant.
Yes.
The question came in, are the current 3 vaccines that are available effective against the variants?
Thank you. Thank you for that very important questions. And the virus, this type of virus, we know from day one that they mutate very quickly. But most of the time, that they mutate and then it go away. They don't stick, right? And then there are certain mutation or certain variant stay around longer, and then so it creates a problem if that mutation, that variant, behave very differently from the original COVID-19 virus, right? The coronavirus. And so some of the behavior that the variants we heard about on the news is that these variants spread quickly. Not necessarily deadlier, but they spread quickly. And that's why this whole idea that even when you get vaccinated, you still need to wear a mask, because just in case you get infected by these variants, that you don't spread it very quickly, right? But as of now, as we know more about the vaccine, we do know that the current 3 vaccines are pretty protective of these variants, with the exception of the South African variant, right? So right now in California, we have the California variants that you heard about. It seemed like it's been protective. We've gotten the Brazilian, just 1 case a couple of days ago in Southern California. And then we also get the English, the British, the UK variant here in California. But so far, the vaccine been protective for folks. We will learn more, and then we will make sure that we inform the public more. But the bottom line is we need to make sure that we have more vaccine coming to Orange County, push vaccine out as quick as we can to as many people who want it, because that's the only way to stop the variants from growing, right? So we're hoping that the vaccine are first of all protective, and secondly, perhaps prevent people from getting infection. So there's some study now shown that it might be protective from even getting infected. So more news to come as we learn more about this virus. Remember, this virus has only been around a little bit over a year. So there's so much improvement in science. There's so much that we have learned, and I know we will learn even more as time goes by.
Right. So as a follow-up to the last question regarding the variants, for instance, just like the flu, there are different strains of flu that come up every year, and you get the flu shot each year.
Yes.
So with the different variants of COVID-19, and there may be more after a person gets vaccinated, there may be more variants that come up. So on an annual basis, do you see that there may be a need at some point for a booster shot each year to make sure that all of the variants would be covered?
Yes, definitely. We know that sometime down the line we will need a booster shot. Even without the variants, we would need the booster shot. We just don't know yet when. Perhaps it could be 6 months from now, or for those who have completed the vaccine, right? 6 months from now, or 12 months from now, or is it 2 years from now? We don't know yet, right? But we do know that booster shot is required. In fact, all the platform, all of those 3 vaccines is now working on some modified version of the vaccine for the booster shot. So.
Okay, and then can you talk about the hospitalizations and ICU rates and that type of thing? Now that we've got the vaccination process well underway, how that's impacting our overall COVID statistics and hospitalizations and ICU bed rate? Yeah,
so as you remember, early on, even late December to the end of January and early February, we were in a surge, and where the number of people who were hospitalized, especially occupying the ICU bed, was very high, and it caused the entire state to go on a lockdown because the number of ICU beds available was so small, and that we were afraid that we would have to make decision on which person will qualify to go into the ICU. Thank God we didn't need to do that. We didn't need to go there because of the certain decrease in the number of hospitalization in ICU. So right now, our ICU and our hospital capacity is really good. The last number I looked at is over 30-some%. Please don't quote me on that. There's so many numbers to remember, but I know we're in very good shape, just like most of the Southern California county in very good shape. And that's why we got out of the lockdown, and we're beginning to move down the tier in our blueprint. But that's very important. Important for you to ask that question was, is because of that in Orange County, we look at our statistic at that time to find out, well, who was in the hospital and who was in the ICU bed, and most importantly, who have died in Orange County. And what we found was, during the height of our search, 70% of folks who occupied the hospital, as well as occupying our ICU bed, were senior. And then when we look at how those who have passed away in Orange County from COVID, who were they? 75% of them were senior over the age of 65. And that's why we made the decision, thank you Supervisor Bartlett and the entire board, to support us to be the first county to declare that we must vaccinate our senior. Those are the most vulnerable members of our community, and we must vaccinate them. And as you know, the next day, the entire state was moving that direction. And I'm glad we did that, because I believe with the vaccine, those seniors, we have saved many, many lives. And that's why we've seen the drop in the number of hospital bed that are occupied by people with COVID, as well as ICU, just drop very, very quickly. So.
Well, I think we're on the right track.
Yes, ma'am.
So we're coming to an end of our talk tonight. I want to thank everyone again for joining us, and I want to thank Dr. Chau for joining me to continuously work to keep our county safe and healthy. And if you have any further questions, I know we weren't able to get to everyone's question tonight, but if you have any further questions, please call our hotline at 714-834-2000 or go to our website at covidvaccinefacts.com. Thank you very much for joining us this evening.
Thank you. Good night.